Hi, it's Cindy from the Osterville Library, and today I'm thrilled to have with us the Chief of COMM, Centerville, Osterville, Morrison's Mills Fire Department, and to talk to us about all the things been going on with COVID. And thank you so much, Chief, for being with us today. I know how busy you are, so I will get right to it. What has COMM's response been to all this that's been happening with COVID?
First, thanks for the opportunity to come and speak to the folks at the Osterville Library. I appreciate the opportunity. I'm proud to say that we started paying attention to the coronavirus in the middle of February. In fact, we had a captain's meeting on February 18th, during which the focus of our captain's meeting was what would we do if the pandemic reached Cape Cod and reached us here at COMM Fire. As an EMS agency, we're always in the front lines on dealing with these type of events, and much like Ebola and SARS, we began planning for the coronavirus immediately. By the first week of March, we had, like everyone else, very limited information, but clear signs that this was going to have a tremendous impact on our community and our country. And we began to implement internal control measures here at the fire department for our people, specifically to keep them safe while they were on duty. Our first drastic step, which really caused us a great deal of anxiety, was we closed our buildings and facilities to the public. For generations, we've told people that the fire stations are safe places, and if you need something, you come to a firehouse. For the first time in my 29-year career, you could ring the doorbell, but we would meet you outside, and that was just something very different and unique for us. And so we started closing our stations and limiting public access. We immediately began to require our staff to come in through limited doors with the purpose of, as they entered the door, mandatory hand washing was required before entering the building. Placement of a face mask, and then temperature checks as they came to work. I'm proud to say that these control measures, because we started them early and we had understanding and compliance from our people, knock on wood, has kept us COVID-free in-house, which is a simply remarkable statistic with what some of our other sister and brother agencies are dealing with. We also added a new line of questioning for our dispatchers, which I know caused some angst for callers when they called in. Normally we would ask name, address of the emergency, and phone number. We added 3 additional questions when folks were calling for emergency medical services, which were, have you traveled recently outside of the country? Do you have any flu-like symptoms? And do you have a fever? In our effort to do that, we were just trying to give our responders a complete, accurate picture of what they were responding to, so they could gear up the necessary PPE in the event someone had an exposure to COVID-19 or was actually sick with COVID-19.
Well,
it was really important, and again, I say proudly, we've kept our people safe, and that's our mission on a day-to-day basis. So,
and that is so true, because you say they do go home to their families and their parents, and the overwhelming fear on them to not make anybody in their family sick is got to be an incredible albatross.
It was huge, and it still is huge. And some of our brother and sister response agencies saw 30 and 40% reductions in staff when one responder was exposed to COVID due to the 14-day quarantine model. If we were quarantining our staff because of an exposure, we would eventually run out of staff to answer 911 calls. And simply the best way to do that was to protect our people as best we could before they got on the call. So all of those things worked really, really well for us. At the same time, when you talk about community response regarding COMM, we're very fortunate here in the town of Barnstable to have an amazing emergency management director in Chief Sonoben and an amazing public health director in Tom McKean, working collaboratively with the fire districts in Barnstable. And those individuals, we were able to put together very early some planning meetings that included epidemiology experts from Cape Cod Hospital and infectious disease experts from Cape Cod Hospital. And we began to formulate a plan for what this would look like for the town of Barnstable should we have the numbers that were being presented in Italy and Iran and in China. Those meetings were fantastic to set an expectation and establish communication lanes so that we could stay on top of everything and everyone would have the same information moving forward. So those are good things that we did, and I'm proud of that effort because I think it's made a difference here in our community. Another struggle we had, and I just point this out because it's coming up again now in our Sunbelt states, is a genuine struggle to obtain the proper PPE to keep first responders safe. As on an average, I guess we would have several hundred N95 masks in place. we were anticipating, and thankfully we didn't see quite the surge that we were anticipating, but we were expected to burn through that stockpile of PPE within 2 to 3 weeks of the COVID really running rampant through our community. There was some real anxiety, and there was some real concern that, you know, we would either A, run out, or almost equally as bad, we would have to reuse PPE and find a way to sterilize and disinfect it for its next use. Thankfully, our partners at the state and our partners here locally were able to procure some PPE. We were able to stockpile some PPE. We were able to make sure not one agency had more PPE than any other agency. But it was a real concern, because as soon as COVID hit, nationwide, there was a shortage of PPE. And that's something that we've got to not forget and prepare better for the next wave of this as it happens. So those are some real things. And then lastly, I think for us was immediate engagement with our skilled nursing facilities. As we saw across the country, especially in the Northeast, the COVID-19 entering into a skilled nursing facility had a terrible impact on those facilities. We were lucky here at Centerville, Osterville, Marston's Mills, where we had great partners that engaged us early. We were able to work with them to identify internal control measures for them, make sure they had adequate PPE and training, and really stay on top of our skilled nursing facilities, because it truly is a perilous situation if it gets into a skilled nursing facility. So those are kind of the things. And to be honest, they were all happening at once. It was, it's been a very, very hectic, let's call it March, April, May, June. Now we're into July, almost 6 months of preparation and response.
Well, that's why we all know that COMM is the best fire district.
Thank you. I agree.
So
we
guys
certainly
live
are.
up to that. So
and it's the people here that make it the best, and the support we get from our villages.
Yeah, but leadership has a lot to do with it.
Thank you.
Like, you know, people, you know, the whole mask thing now, and you know, we're moving into stage 3 with the government, and that, you know, it's still important for people to wear masks. And as we say, it's not a political issue, it is a safety issue. Can you just talk about the masks and the washing of the hands and the social distancing, why it's still important?
Sure. So I appreciate you bringing it up that way. You know, what can we do to prevent COVID-19? As I mentioned, we very early had incredible meetings with our infectious disease experts at Cape Cod Hospital, epidemiologists at Cape Cod Hospital. And what we were talking about in February even was the fact that there was the potential for waves of COVID throughout the summer of upticks and then declines and upticks. And then a massive surge was predicted very early in this conversation for this coming fall. And that surge was predicted and forecasted to coincide with our normal flu season in the United States, which we know on average takes 40 to 50,000 lives across our country, folks with comorbidities that get the influenza. So as we move toward, someone said to me the other day, Labor Day is six weeks away. I almost fell over, like, where did our summer go? You know, if we do see this uptick, and I hate to say, I think we're seeing some of that in our Sunbelt states with the numbers they're recording on a day-to-day basis, it's going to become imperative to keep the good hygiene and control measures in place, such as vigorous hand washing with soap and water. And when I say vigorous, my son and I, we sing happy birthday while we wash our hands, because it's about 20 to 30 seconds, depending on how fast we go. Vigorous hand washing with hot water and soap. Or if you can't have access to that, an alcohol-based hand sanitizer, and again, vigorous hand washing with that. You know, avoid touching your face, avoid touching your eyes, your nose. During the initial stages of this, I was consciously trying to stop myself from touching my hands to my face. And it's not easy. It's something we just do. It's human nature. And here's our hands and we touch our face, but it really does make a difference. You know, keep things clean that are touched frequently. Doorknobs, car handles, drawer pulls, anything that folks have access to that may not have washed their hands, keep those things clean, because we do have some science that the COVID can last a long time on those type of surfaces. And, you know, it's funny, we talk about wearing the masks. I have my mask. My mask is right here. I wear my mask everywhere I go. And I can't tell you how many times in a day I get up from my desk and race out my door and go, "Oh, Mike, you forgot your mask," and turn around and get my mask. But masks are really, really vital. There's indisputable science and common sense that should show that wearing a mask, if you have to be within 6 feet of another person, really makes a difference and reduces the risk of spread of COVID-19. I saw something online the other day that said it's perhaps as much as 65% reduction by wearing a mask. To me, that's 2/3. I'll take those odds. It really does make a difference.
And two, with wearing the mask, it's got to cover your nose and mouth. It can't be like one. I see a lot of people, like when they run into somebody, they go like this and start talking. It's got to be, over your nose, wire, a bridge,
Absolutely.
and that.
Absolutely. It's got to cover your nose and mouth. And I fully admit and disclose and agree. It's a pain. It's
Yeah.
a hindrance. It's 85 degrees with 90% humidity. The last thing you want to do is have a mask on your face, but it really could make a difference on whether or not you become infected with the COVID-19. If you have a comorbidity, there's no reason you shouldn't wear a mask. It really could protect you. So the masks are important. And it's funny too, that one of the things that I think is common sense and is only begun to really be emphasized right now is you've got to stay home if you're sick. If you're sick, you have a fever, you've got to stay home. The transmission rate on this is, still mostly unknown, but highly, highly transmittable person to person. And we've just got to stay on top of those things and make sure that we stay home when we're sick. We don't go to work. We don't go to church. We don't go to the mall. Stay home if you don't feel good. That's the best thing you can do. So,
And they should call their doctor, their personal doctor, right away. And
yeah, absolutely. Absolutely. As I mentioned, if you have the comorbidity or an underlying health condition, you're extremely vulnerable to COVID-19. I cannot emphasize how vulnerable you are. And, if you're sick, you should stay home. If you have to leave your house and you have a comorbidity, the only places you should really go is you should either go to a healthcare appointment, a pharmacy to pick up prescriptions, or if necessary, go to the grocery store and get your groceries. But beyond that, honestly, there's not a lot of reasons to do anything in big groups or go someplace where there could be a big group. The actual Safer at Home advisory from Governor Baker recommends that we should only be leaving our homes for healthcare, worship, shopping, and permitted work activities. And it seems impossible as our summer guests and residents return to Cape Cod to enjoy our beautiful communities. But restaurants, are open at new capacities. Beaches are open. But the truth is, if you have a comorbidity, you should strongly consider what those activities mean to you and the risk of catching COVID-19. It's something you really need to pay attention to. So those are really, really important. And the telemedicine has made leaps and bounds progress since COVID-19. I think about all of the different uses of let's call it Zooms or go-to meetings, or a lot of business and a lot of way we do business is being changed by COVID-19. And this type of an interaction has become almost the new normal, where we Zoom and communicate. So there's a lot of stuff going on because of this.
yeah. So one thing too is, if I know a lot of people who have other conditions or other things are afraid to call 911 or go to the hospital because they're afraid of catching COVID. And I know a lot of times with heart attacks, strokes, and different medical conditions that can make things worse. So can you talk to that point?
Yeah, actually, I really appreciate you bringing that up, Cindy. The question always is what do you do if you feel sick? First and foremost, stay home. Contact your doctor, or your healthcare provider by phone. Let them know what's going on. Use telemedicine when at all possible. But I'd really like to emphasize to the viewers who watch this video, if you're sick and you have a high fever and you're having difficulty breathing or you're struggling with shortness of breath, call us. That is what we're here for. And we're open for business. The emergency rooms are open for business. We've taken great measures to protect not only you when you call us, but to protect us. And we will be there to deliver whatever services you need in the field. And I'm sure many have seen the 5 major hospitals in Boston have put together an infomercial stating the same message. There was an actual decline in emergency room visits when COVID-19 broke, out of fear of going to the hospitals because people didn't want to catch COVID-19 in the hospitals. The truth is, they have taken measures and put measures in place that protect you, that protect them, and hospitals are a safe place to go. And so are ambulances. If you need help, you're having trouble breathing, you're having chest pain, please call us. We will be there. You'll be safe, we'll be safe, and we'll get you feeling better as quick as we can.
We talked about people wearing the masks and that's like what people should continue to do and not get left as we go through the reopening phases. Are there other things that you would like people to know to help and
Sure.
move forward?
This is my plea to the community. As fire chief, I can't get involved in politics, and I ask that you consider the same with regard to COVID-19. Listen to the experts. Listen to Dr. Fossey. He's a world-renowned expert. This is what he does. This is his lane. He is genius at this, and his information is the information I pay the closest attention to. Listen to the experts. You know, we all talk about COVID-19 and its physical effects on us, but I think it's really important to also recognize the mental health component of COVID-19. Our entire world has been flipped over in about a 6-month period. The way we've done business forever is now completely foreign and in the rearview mirror. The new normal is still developing as we're recording this video today. So if you're having trouble with mental health, or you're having trouble with depression or anxiety or any of the things that can come with this type of a change in lifestyle, reach out, talk to a loved one, talk to a trusted friend, reach out to your doctor and let them know. This is it's a huge burden on all of us, and no one's immune from it. Even our responders here, you know, myself included, there's been a real anxiety about helping someone, following our pledge to our community, but then potentially taking this COVID-19 home to our families. And that burden wears on us day in and day out. And it's really important that if you're struggling with some type of anxiety or depression associated with this, talk to someone you love, talk to a trusted friend, or reach out to your doctor, because it does make an impact. Yeah. I mentioned earlier about the waves. At COMM, we're preparing for potentially a fall uptick, a fall surge. As I mentioned in one of our first meetings with Cape Cod Hospital, one of the physicians in the room, a remarkably bright man, said that we're going to see waves of this as the summer progresses, and it's going to go up, and then we're going to have a little drop, and then it's going to go up, and then there's going to be a little drop. And then when the fall rolls around, there will be a substantial surge in cases. He didn't say in the Sunbelt states. He didn't say in one particular spot. He said there will be a tremendous surge. So we're preparing for that. We're planning for that. I just pray we don't have to see that. So folks should also pay attention to this. Dr. Fossey is saying the same. There's the potential for a tremendous surge in this, and it will coincide with the normal flu season. And the normal flu season, we already know, claims on average 40,000 American lives a year. This could be devastating if there is a surge that coincides with the normal flu season. And what's COMM doing now? We're slowly reopening as well. We're following Governor Baker's reopening plan. We're in phase 3, step 1, if I stated that right. We're slowly opening our administrative offices to our walk-in business. We will keep our facilities closed for meetings and gatherings for outside of COMM business. We've started to have our fire commissioner meetings back being held in person. We had used Zoom for the last 3 months. But right now we're focusing on preparing and planning for a surge in the fall and continuing to provide the highest level of service we can to you folks. And I just in closing, I would really like to just reemphasize, if you're sick, call us. I mean that. We will be there. We will give you the best service that we can give you, and we will protect not only you, but we'll protect ourselves, and we'll get you the help that you need. So
I appreciate that. And I think, just to reiterate what, everybody can do here that's listening is, keep the hand hygiene and wear the mask, because that can help us not have a wave, or at least have a little wave, not a big wave. We don't want a tsunami. We want, a little ripple.
So, and that's a great description, Cindy. A tsunami, man. It's a real concern. And good hygiene, social distancing, wearing a mask, and staying home if you're sick will all have an impact on those.
Well, I appreciate your time so much. Is there anything else? Did we cover everything and we appreciate.
No, I'm grateful for the time and the opportunity to speak to the folks at the library. And should you ever have any questions, or you have any input you'd like to offer, we take everything very seriously. We listen to everyone. You can email me at mwinn@commfiredistrict.com. or you can call the firehouse and I'll get right back to you if you want, 508-790-2375. So thanks, Cindy. And if,
Thank you. We appreciate your time. And again, thank you for all that you're doing. I mean,
thanks.
we are so blessed to be here with your leadership and the leadership that we have around the town during this time. So we're very grateful, and thank you very much.
Thanks. Have a great weekend. Thank you.
Thank you.
Bye.